Nail diseases can affect the fingernails and toenails, and they can be caused by various factors, including fungal infections, bacterial infections, trauma, underlying medical conditions, and poor nail care practices. Here are some common nail diseases and their treatments. Fungal nail infections, onychomycosis. 1. Treatment. Fungal nail infections are typically treated with antifungal medications. 1. These can be applied topically as nail creams or solutions or taken orally as prescribed by a doctor. 1. In some cases, the affected nail may need to be removed surgically. Bacterial nail infections. 1. Treatment. Bacterial infections of the nail may require antibiotics, either in topical or oral form. 1. In severe cases, drainage of any pus may be necessary, and the affected area should be kept clean and dry. Ingrown nails. 1. Treatment. Mild cases of ingrown nails can often be managed at home by soaking the affected area in warm, soapy water and gently lifting the ingrown edge. 1. Severe cases may require medical intervention, including partial nail removal or surgery. Psoriasis of the nails. 1. Treatment. Psoriasis affecting the nails can be challenging to treat. 1. Topical or oral medications, as prescribed by a dermatologist, may help manage symptoms and reduce inflammation. Nail lichen planus. 1. Treatment. Lichen planus of the nails may be treated with topical or oral corticosteroids, along with other medications prescribed by a dermatologist to reduce inflammation and discomfort. Nail trauma. 1. Treatment. Minor nail injuries can often heal on their own. 1. However, if the nail is severely damaged or detached, seek medical attention to prevent infection and promote proper healing. Nail fungus prevention. 1. To prevent fungal nail infections, practice good nail hygiene by keeping your nails clean, dry, and trimmed. 2. Avoid sharing nail clippers or files with others. 3. Choose breathable footwear and change socks regularly, especially if your feet tend to sweat. 4. Use antifungal powder or cream if you are at risk of fungal infections. Underlying medical conditions. Some nail changes can be a sign of underlying medical conditions. If you notice significant and unexplained changes in your nails, consult a healthcare professional for a proper diagnosis and treatment. Nutrition and general nail care. Maintain a balanced diet rich in vitamins and minerals. Keep your nails clean and moisturized, and avoid excessive use of nail polish and harsh chemicals. Remember that it's essential to consult a healthcare professional or dermatologist for proper diagnosis and treatment of nail diseases, as they can accurately identify the underlying cause and recommend the most suitable treatment options for your specific condition.